Recently, I had the new experience of having to let a client go. All in all, though, I count this as a very positive experience for Stock Rose Creative. Not only did I get to build a relationship with an amazing founder, but what I learned from that experience led me to create the quarterly content subscription, which makes it so much easier for health companies to build brand loyalty with their ideal customers and clients, to establish themselves as thought leaders in their industries, and to improve patient health outcomes. Today, I want to take you behind the scenes of the quarterly content subscription. We'll go into the details of how the subscription works, how health brands are using the content subscription, and how your health company can also benefit from it. By the way, I'm NICHOLE. I'm a public health pharmacist turned healthcare copywriter and content strategist. I help innovative health companies and private medical practices develop and execute culturally relevant content strategy so that they can build brand loyalty, improve patient health outcomes, and increase their bottom line. Go ahead and subscribe to the Health Content Marketing with Megan channel so that you will stay up to date on the latest trends in health content marketing. You may have heard the story of how I began content writing while working at the CDC. Writing is fun for me. It truly is. But in order to make an impact for my clients, writing can't just be fun. It has to be strategic and it has to be tied to very specific business goals. So I set out to make sure that if a company was benefiting from my writing or writing that comes through my company, then they're also benefiting from my content strategy. You do not get one without the other. As you know, every health brand needs a formal written content strategy. So I thought to myself, how can I streamline this process so that it is comprehensive yet simple for a company to have this strategy developed? How can I standardize this process so that it is applicable to any health brand? Those questions led me to create the 5C framework. The 5C framework is what I use to develop a health brand's content strategy. It includes their content history, their customer and client, their competition, their core expertise and services, and their calendar. 5C framework. We take into account each of those elements in order to combine them into the perfect content strategy. This framework is ideal for digital health companies and private medical or health practices. Bonus points if these are B2C digital health companies. B2C allows for a little bit more creative flair and cultural relevance than you might have with a B2B company. So here's how it works. You might have guessed from the name that the quarterly content subscription operates on a 90-day basis according to the calendar year. At the top of the 90-day period, you or a representative from your company completes a survey and we discuss that survey. I use the information from that survey and from our discussion to create your content strategy for the 3-month period. After I develop your content strategy and you give it the thumbs up, we then move into the process of content creation, using all of those ideas that we've talked about thus far. At the end of the quarter, we take a look at the content we created, how it performed, look at those analytics, and use those to tweak the strategy for the next quarter. The key here is that we collaborate to identify what your business goals are for that quarter and figure out how content can help you in a realistic and practical way to achieve those specific business goals. What makes the quarterly content subscription different from other content marketing solutions? 3 things. 1 is the emphasis on content strategy. The bulk of this process that involves you is going to be around providing the information we need in order to develop an effective content strategy. There is no content creation without that strategy to guide us. The second thing that differentiates us from other content marketing solutions is the emphasis on embedding entertainment and cultural relevance through your content. Now, you have the option of only using our service to develop your strategy, but if you want someone to execute that strategy for you, to create the content, we're more than happy to do that as well. And we are really excited about that because we get to use what you have given us as far as your ideal customer and client to really dig into their backgrounds, into their culture, and incorporate that into the content that we create so that when they read a blog post, when they watch a video of yours, they understand that this is meant for me specifically, and that boosts your brand loyalty to the highest level. The final thing, the third thing that separates separates us from other content marketing solutions specifically for healthcare is that content strategy and creation are led by a pharmacist, a healthcare professional. There is a beautiful marriage of health backgrounds and health communications backgrounds that we are able to combine through our quarterly content subscription. That benefits you as a company because you don't have to educate us on how to do research or where to find accurate information. And at the same time, we're able to use our copywriting and content writing background to apply that creative flair to the content creation process. So you get the best of both worlds. When you enroll in the quarterly content subscription, what can you expect to see? You can expect to see more online engagement with your health content. So if we are helping you develop content that gets you found in Google search, you see greater amounts of incoming traffic. If we are creating content that gets you more social shares, you are seeing that increased social engagement. The beauty is you don't have to do it yourself or assign people on your staff or people within your team to do this work. You are able to outsource it to the experts so that they can do it on your behalf and do it extremely effectively. It's true, content marketing is a long game. Content marketing does not produce instant results, but that doesn't mean that you won't begin to see some of the results sooner than later. Through our subscription service, you are automatically committing to 3 months of content marketing effort. But in order to really see the results you want, that sweet spot is going to be between 6 and 12 months, depending on the age of your website and your other online real estate. Enrollment in the quarterly content subscription service happens every 3 months. So currently we are in an enrollment period, and that enrollment period for Q3 ends on Wednesday, June 24th. So you have a few days to get in contact with us and see if this might be a good fit for your health organization. I should also add that there are 2 spots left as of June 17th. If you like to explore what working together would look like, learn a little bit more about the quarterly content subscription, you can go to megannicole.as.me/content. That link is in the description box for you, so you can just click on it there. Set up a time on my calendar that is convenient for your schedule, and we will talk more about your health company's needs, what our team can offer, and how we can work together. I look forward to talking with you, and I'll see you next Thursday.